Good afternoon, Minnesota. Today I'm joining you for the first time from the State Emergency Operations Center. I want to give a big thank you to Director Kelly and the people who are working here. This is a busy place. This is where a lot of the points of the spear come together and things are directed on COVID-19, but on other state emergencies. As we mentioned yesterday, we've activated the Minnesota National Guard, who is on site, I believe, as we speak, in Marshall County up in Oslo for the flooding, and it is coordinated out of this building in St. Paul. So I want to thank you. To the reporters and the media that are here, thank you for the work that you've done remotely, as we've had to do this from my self-quarantine. And I also want to mention to the people of Minnesota, because of social distancing and the nature of this room that we're in, the media is working in a pool rotation where they are asking even for others questions. So the collaboration and cooperation that's happening to get information out, I'm deeply grateful for. Once again, we are sad to report we have 5 more COVID-19 related deaths, bring our total to 39. Once again, I believe 4 of those were in long-term care facilities, and it's an area that we are, of course, focusing on. I am glad to announce that we were able to get our approval from the federal government for our state emergency declaration. Want to thank the federal government and FEMA for the quick response on this. We're moving into the next phase already, as we said, but that'll free up a lot of dollars. I've spent the morning on the phone with the nation's governors, trying to take a look at what the CARES Act's going to do and some of the concerns that we have and some of the things that are positive, and then start thinking to the next level of what we need to do. With that being in mind, it was 2 weeks ago that we issued Executive Order 2020, the stay-at-home order for Minnesota. At that point in time, we were pretty clear of how what we were trying to do. So what I'd like to do is I would like to bring us up to where we're at on this. The order was set to expire on Friday. I want to talk about what we're going to do next in extension and what's driving some of these decisions. And more importantly, how are we looking at triaging for the short term, and then how are we making sure that bridge as we start to think about coming out of this and maintaining for the long term until we get a vaccine on COVID-19. So what I ask you to do, Minnesota, and you've done in a spectacular, very Minnesota manner, is to buy us time by following these rules, by social distancing, by making sure that we're staying home. We're doing distant learnings across the state. And again, I want to applaud the folks who are making that happen and supporting each other, our critical care workers with daycare, all of the stories you hear about folks getting together, cooking meals for them, making sure they're able to continue that. That's what we asked you to do so that we could buy the time necessary to plus up our hospitals, to increase testing, and to see what this thing is going to look like on the other side of it. So I'm going to ask you, we're going to continue to buy time. I'm going to extend today the stay-at-home order until May 4th from the April 10th. We will then align the public accommodation order. That's the issue on bars and restaurants and amusement activities, from May 1st to May 4th. This will give us the time necessary to build that prevention and the treatment capacity. I'm going to talk about how we came to this decision, what are some of the implications of it, and where we're going to start thinking differently about this as we come out the other end. On this one, and this is one, if Jan, if you want to, Commissioner Malcolm, if you want to chime in, why are we extending the orders? What are we looking at? First of all, the CDC came out with their guidance to the end of April, 1st of May, which is basically being interpreted by 42 of the 50 states as stay-at-home orders. It was articulated to us by Dr. Fauci that way, and I think many see it as that. Of course, actions by peer states, and especially those who are early on in the curve, seeing things that were working for them that were making a difference. Looking at epidemiological data on learning more about this, the thing about COVID-19, just in the time since that March 25th announcement on the stay-at-home order, it's hard to imagine that it was 2 weeks ago and only 12 days into this stay-at-home order, how much more we've learned and what's come on board. Just this morning, FDA approving the serological tests on antibodies with basically the finger stick. On with the governors, the federal government is telling us they're going to be producing millions of these by the first part of May and doubling every 2 weeks. Minnesota is going to take a look at that to make sure we have the capacity capacity to do it. Looking at our modeling, which we'll show a little bit, the folks over at the University of Minnesota Public Health, we created one of the first ones in the nation. It's the only one that's populated with Minnesota-specific data. At the time we released our first one, I believe we had one case of community spread. Of course, now we have hundreds. At that time, I think we had one death in Minnesota, and of course, now, unfortunately, we have 39. The experts we're listening to, that being the hospital associations, and I know that every time I start to speak about changing the stay-at-home orders, our hospitals and our healthcare professionals get really nervous about what that means. And again, that's what they're asking for. So federal government recently extended their nationwide distancing. CDC continues to provide strong guidance for us on social distancing and limited travel, and vast majority of states have continued to do this. Now, I want to take you through some of the data and some of the things that we're putting together. And for those of you at home, if you're seeing what's on the screen, just explaining a little bit about this. What this slide is showing is, and it's normed pretty well with a select group of states, this was the days, and it starts at day 0 on the bottom on the horizontal axis of when you got your first 100 confirmed cases of testing. And Minnesota was testing about right in the middle, so trying to norm this out, this is about as close as we could get. So we were about in the middle of the pack, and this is on, you see on the left side, and I'm sorry, I'm going to step away for just a moment, the cumulative cases per 100,000 of what we were getting early on. And then it takes off and shows the curve. And Minnesota has remained relatively flat. And you heard Commissioner Malcolm talk about this. We were seeing early on a doubling about every 2 to 2.5 days. We've been able to get that out to about every 8 days. And what we're seeing now, and what we didn't see and no one had the data necessarily on, was what the social distancing measures were doing for this. But I want to note something. So here we are since that happened. This is modeled to 15 days out of what happened to those first 100 cases. And we went now from about 2 to 100,000 to about 17 per 100,000. And that puts us at the best in the nation. But here's what I want to caution you about. If you look towards the bottom, and I will walk over and show some of you where that's going with Louisiana, on where they started lower and where things shot through the roof. The same thing with Michigan. Michigan being lower than us when they got their first 100 cases, when they had a lower percentage of per 100,000 than we did. In 10 days, 9 days, we were the same with Michigan, that they had caught up with us and they were at 2. So they had gone 4 times faster in just the 8 days. In the next 10 days from that, they have shot through the roof. And that's where you get the pressure on the hospitals. So I want to show you this point in time. Looking up here and looking at some of the states and looking at New York, Michigan, and Louisiana. Take New York with the longest one, I guess. Maybe it's the easiest one to show you that. New York also the same way. If you follow it down, they were the same as us 10 days before this. It took 10 days for us to remain flat and New York to go to crisis situation. So the reason I want to point this out and bring this slide up is we cannot rest easy. This thing can explode overnight if you don't take the proper precautions. And I'm not saying New York didn't take the proper precautions. The problem is that many days back, no one knew how quickly this was going to go. No one had the social distancing in place long enough. So the move to go to social distancing, the move to go early has kept us relatively flat. So